When we inhibit WEE1, we are forcing the cell to enter into mitosis, causing mitosis catastrophe and causing that the cell is going to die. For that reason, combining WEE1 inhibitor, such as the Debio with DNA damage agents, such as carboplatin, makes perfect sense. Therefore, we decided to open this study back in 2019 to do a dose finding of these two agents. This study was designed for as a dose escalation in all solid tumors, so it's an unselected patient population. However, we started to see a signal in gynecological cancers, such as ovarian cancer. That's why there was an enrichment of patients with ovarian cancer. And indeed, when we look at the patients with platinum-resistant ovarian cancer, it's the patient that we have seen the highest chances to get a response and higher tumor activity. And this is indeed the patient population that we are going to move into the expansion cohort. What we have seen is that the safety profile of this combination is quite well tolerated and the safety profile is manageable. We have seen that we are not adding toxicities on top of what we could expect for carboplatin monotherapy as a backbone therapy. And intriguingly, we have seen that there are good signals of anti-tumor activity when we are combining these agents. In patients with platinum-resistant ovarian cancer, we have seen up to 40% response rate with a stable disease in other patients and having a disease control rate of 100% with long duration of treatment. The future implications that we can get from this research are quite useful. So we need to bear in mind that this is not only for the research that we are going to perform in platinum-resistant ovarian cancer. If we confirm this signal in the expansion cohort, this could trigger further development in this heavily treated and hard-to-treat population. But apart from that, in addition, we can open the door for more research. Indeed, in our clinical development plan, we are currently exploring other indications such as small cell lung cancer with platinum-based chemotherapy, like carboplatin plus etoposide. And this is because of the good safety profile that we have observed in this research. Moving ahead, the development of WEE1 inhibitors, Debio it can add a lot of value for patients and as well for the company. The hope that I have is that this is going to be a success, or we are going to show good efficacy in patients that we are going to test, not only in platinum-resistant ovarian cancer, but as well as monotherapy in the cohorts that we are expanding at this moment, and as well in other indications that we are exploring, such as small cell lung cancer or glioblastoma.